Meanwhile, today, Governor Ralph Northam outlined two new initiatives in the fight against coronavirus: more help for nursing homes and relief for some Virginia inmates. He made the announcement during his regular briefing. Inmates in Virginia prisons have been restless, claiming they are too close to one another with no way to social distance, no place to hide from the coronavirus. In response, Governor Ralph Northam is proposing the release of inmates with less than a year to go on their sentences.
I'm proposing an amendment to the state budget that would give the Department of Corrections authority to release offenders who have 1 year or less left in their sentences. They must have demonstrated good behavior and not be a threat to public safety.
Northam says there are about 2,000 inmates in Virginia who would qualify. He also wants to fast-track their re-entry, making sure they have a place to live and 3-month supply of medication. The plan would need to be approved by the General Assembly later in April. Another major initiative, building support for long-term care facilities. Henrico County's Canterbury Rehabilitation and Healthcare Facility outside Richmond has made headlines after nearly 40 people have died so far, 6 in just one day earlier this week. The governor is creating a task force headed by Dr. Lori Furlano that will redouble efforts to make sure these facilities have the financial resources they need, as well as testing and staffing and communications about where the virus is appearing.
The people who live in long-term care facilities are already vulnerable to sickness. And now, because of social distancing, they can't even see their loved ones. But these are our parents and grandparents. We have a special obligation to protect them.
The Elder Care Task Force is set to begin work immediately, while the corrections program would become effective as soon as it's approved by the General Assembly. The governor also wants to create more avenues to recruit volunteers for the Medical Reserve Corps. He prefers people with some medical experience, but there is a need for people with other skills as well. To sign up, you can look for a link with this story at WSLS.com.